Okay, welcome to pathophysiology. We will start today by reviewing some concepts we use to establish the characteristics of disorders. As always, here you have the objectives of the lecture. So we will basically learn to define some general concepts related to pathology. Pathology and illness are synonyms, and they relate to changes of the normal structure or function that produce or are produced by a disease. As physiology studies the normal functioning of cells, organs, and the body as a whole, pathophysiology studies what and how that normal functioning is disrupted. For any given disorder, there is a cause or an etiology, a process from normal to abnormal or pathogenesis. Clinical manifestations that show up like signs and symptoms, a way of identifying the disease or diagnosis, an evolution of the disease or clinical course, and a way to return to normality or limit damage known as treatment. Many times we can identify what is causing a disorder. We call that etiological factors. They can be biological, physical, chemical, nutritional. Different agents can damage the same organ. For instance, alcohol and mercury can damage your liver. But also, a same agent may cause damage to different organs, like alcohol can damage your liver, but also your vessels. Have in mind that most diseases are multifactorial, meaning that several things need to happen to cause the disease. We need to distinguish congenital defects which already exist at the moment of birth from acquired factors that you get after birth. Many diseases have both components, so you have a genetic predisposition to have a disease which is triggered by an external event, like an infection. Pathogenesis is the story of the development of a disease from the first event to the end result. It is very important to understand a disease in order to develop ways to detect it and to treat it. Then we have clinical manifestations that include signs and symptoms. And it is very important to distinguish signs from symptoms. A sign is every effect of a disease that an observer can measure. In this case, you, the doctor, whatever. And in this category, we have inflammation, fever, or anemia. All this can be measured. A symptom is every effect of a disease that we cannot measure, so the patient has to inform us. And in this category, we have fatigue, or dizziness, or pain. Pain is there is no technology to measure pain. You will see that some pathologies are called syndromes. That concept refers to a collection of signs and symptoms, and frequently refers to a complex pathology we don't know well yet. Then we have diagnosis, which is the name we give a disease based on its nature or cause, like COVID infection. That's a diagnosis. Diagnosing is the process of taking a medical history and a physical examination as first steps to arrive to a presumption diagnosis. Then we need to confirm that diagnostic with complementary tests like medical imaging or blood test or any other sort of test, and after that we can produce a final or confirmed diagnosis. Okay, but in interpreting test results is not that straightforward. Okay, so results are affected by some factors that the clinician must consider. Here you have some of the statistical calculations to consider. Okay, don't get scared. We won't dive in mathematics at this moment. Let's focus by now in the ones that are underlined sensitivity and specificity, and apply it to the COVID pandemic we are living and you are familiar with. As you know, we have those PCR tests to confirm the infection. Let's say you get a positive PCR for COVID. Does that mean you have the infection? Well, the answer is no, not for sure. And here is when we go to sensitivity. If you check in the box below, the sensitivity for PCR is 88.6% and the specificity is 90.6%. That means that out of 100 PCRs, only 88.6 of the positives do really have COVID. In other words, 11.4 positives are not really infected. And the same thing happens with specificity. Out of 100 negative PCRs, that means the test is saying, okay, you don't have the COVID, 9.4 negative patients are really infected. So as you see, little things are perfect. In fact, there is not a single test of any kind that has a 100% sensitivity and specificity. Okay, let's move on. The clinical course describes the evolution of a disease. In the coming lectures, we'll frequently use the words like acute, chronic, and subacute. Okay, the definitions here vary depending on the disease. Sometimes there is a definition for an acute disease, and sometimes that definition changes a bit for another disease. So we are going to explain that for every disease when we get to them. All right, about epidemiology, you have to know that it is very important because it offers information about how the disease affects and behaves in a given population. If you know the pattern of a disease, you may develop better strategies to prevent it and to treat it. And in relation with epidemiology, the frequency measures of a disease are probably the most important data to know how the disease is behaving. In relation to COVID, you have probably heard about incidence, which is the number of new cases in a given interval. For instance, new cases of COVID in 24 hours in Spain. And then we have the prevalence, which refers to the total number of cases of a disease at a particular time or moment. For instance, there is, last week when I'm recording this lecture, there is 1 million COVID infected individuals in Spain at this moment. Also, in relation with COVID, you heard about morbidity and mortality. Probably not a lot about morbidity, such in a direct form, but you will understand what it is right now. Okay, first, mortality normally is expressed as deaths per 100,000 people, or a rate in a population. In the white box, you have the mortality for COVID in relation to the age in Spain. All right. So, for instance, you have that for people between 10 and 19, the mortality rate is 0.2%. That means that one young person dies for every 500 positives. Okay, if you go to the bottom of the table, for 80 years of age or more, you have that for every 100 infected elderly people, you have almost 15 that die. Okay, so here you have an example of the use of this data. These two graphs compare the 10 leading causes of death in 1997, which is in the left, and 1900, that is 100 years before, which is in the right. In 1900, the leading causes for, you see here, pneumonia and tuberculosis, which are respiratory infections. If you check that in 1997, you'll see that pneumonia and influenza are at the position number 6. Okay, so and you see tuberculosis is not there. So we have controlled tuberculosis, okay, because we knew it was a problem. It was a problem in 1900. So the leading causes now, if you see in 1997, are cardiovascular diseases and cancer. So with this information, we know where to put the financial effort and all the efforts the society can make. Going back to COVID, you also know that infected patients that end up in intensive care units and manage to recover will drag the effects of the disease for life, especially the lungs are seriously damaged, and that affects the quality of life and probably their lifespan. This is what we call morbidity of COVID, the effects of the disease when the disease doesn't kill you. All right, so anything that contributes to the development of a disease is a risk factor. Some risk factors are external to the patient, like this guy is smoking, and other factors are carried by the patient, like obesity. Risk factors are important to consider during the process of diagnosis, and interrogation of your patients will probably or should start with questions about risk factors. Okay, natural evolution. This is a self-explanatory concept because natural means no intervention. In this case, no medical or chiropractic or whatever intervention we are talking about. And what happens with that disease? How the patient will end, or what kind of life the patient will have with no care. Prognosis is about the outcome of a given situation. You will have to inform your patients about the prognosis of their problems in relation with what you are going to do, your intervention. Something like, look, this low back pain you have will go away in 8 weeks if you do an adjusting plan of 2 adjustments per week. Whatever. Okay, more than ever, today we have an incredible knowledge and technology, and we also have many treatment options to fight disease, but the most important tool against disease is prevention. Next year, you'll learn a lot about prevention in the public health module that is taught by Jose Pineda. But by now, let's just state that there are 3 levels of prevention. The first one is primary prevention, that is about avoiding risk factors, the ones that are avoidable, of course. Your age is a risk factor, for instance, and you cannot avoid that. Okay. Then we have secondary prevention, is about detecting a disease while this disease is still asymptomatic, and therapy will be most effective. And tertiary prevention is about clinical intervention to minimize deterioration and reduce the complications the patient will go through if you don't do anything. All right, and this is all for this video lecture. See you in the next one. Thank you very much for listening.